Hello, everyone. This is Senior Biotech Analyst John Vandermosten. Welcome to our channel that educates the life sciences investor on exciting advancements in drugs, biologics, and devices. For more content and news like this, subscribe to our channel below and like or share with others. We're fortunate to have the CEO of Cingulate with us, Dr. Shane Schaffer, in the studio. He's going to be talking to us about ADHD, the medical condition. And it's quite a common condition that affects many children and a slightly slower proportion of adults. Shane, why has the ADHD market continued to expand over the decades?
Yeah, so if you look at it a couple of ways, children and adolescents, roughly about anywhere from 6 to 9%, depending on what study you look at, of children and adolescents have ADHD. That number has maintained pretty steady over the years.
Okay.
So the children and adolescent market is not growing; it's stabilized, and that's good. If you look at the adult market, however, what's really changed there, the DSM-5 came out and really helped sort of clinicians better understand or really better diagnose adult ADHD, and that's where we're seeing the largest growth.
Well, now if we go 30 years ago, I mean, I guess we didn't really think adults had ADHD so much back then. Is that right? And the perception's kind of changed to realize that it does?
The perception was wrong then.
And
It's a perception. The fact is, this is a neurobiological disorder.
Right.
Basically, you have too many reuptake channels, DAT receptors, which are sucking up all the dopamine in your brain. That doesn't go away with age. What typically happens is a lot of adults choose careers and they use coping mechanisms. Coping mechanisms like nicotine, like marijuana, like alcohol, or they choose jobs in different fields. You won't meet too many adult ADHD sufferers that are accountants, to be clear, or patent lawyers. They just don't go down that road. Guess what? I'm not. I'm not an accountant and I'm not a patent lawyer. So that's been a difference. But we've done a really good job as a clinical community of doing better jobs of diagnosing. Ironically, people think of this, like you said, as a child and adolescent disorder. The reality is it covers the entire lifespan. And the adult market, the adult patients, is double the size of children and adolescents combined. Double is the adult market. Now, the product we've developed, CTX-1301, is designed to treat the entire spectrum of life. From age 6 to when you're done.
And do you think the product's going to be more attractive to children or adults?
I think initially clinicians are going to need to get used to that actually having a product that succeeds in treating your entire active day.
So they may give it to adults
There's never been a product that does that. So I think initially what we'll see is a lot of patients that are currently taking booster doses, which is only 60% of a $22 billion market. I'll take that. That'd be a successful launch. So the patients that are currently on a booster dose, I think that's where physicians will gravitate initially. That's how we would let them sort of test the medication out. After that, there's no reason for a clinician to provide a shorter acting medication to a child, an adolescent, or an adult. Why would you set them up for side effects? Why would you set them up for the crash in the afternoon? One of the top physicians in ADHD, I won't use her name because she may not want me to, but when we launched our first clinical trial, she goes, "You are going to be a godsend to parents." Because the medication has a fast onset. So in the morning, when the kids are getting ready, when they're doing their breakfast, when they're gathering their school, they're filling the book bag, we're going to treat them then. It's going to be one of the few medications that works so fast. And by the time they get off that school bus and come home and have homework to do or after school activities, they're still going to be treated. And this is what parents, what patients, what adults have been asking for over 70 years. And finally we're delivering it.
You know, I was actually reading a news story about a parent somewhere in the upper East Coast. And his kid had the medication at the nurse's office, and he said that his pills were disappearing. You know, I don't know why, but I mean, you don't have to worry about that issue. That whole dealing with the nurse and the child going in and getting it, and diversion and all those other things that are a concern. So it solves that great problem. Well, I wanted to ask you also about ADHD. I think a lot of us kind of understand what the symptoms are, but maybe not precisely what they are. Why don't you tell us, how we could recognize some symptoms of ADHD?
Hold on a second, stop.
Sure.
That's it. So that's impulsivity. Sorry, that was pretty funny.
Wow, you caught me off guard there.
Exactly. This was not planned. So impulsivity. There's one right there. When you interrupt people. So when you're impulsive, you interrupt people, or you grab something real quick, or a lot of times you use the phrase, "There's a squirrel." That's the impulsivity aspect of it. Sorry, I didn't mean to do that. We did not plan that.
That was good.
So that's impulsivity. Inattention is pretty obvious.
Yeah.
So inattention, you're wandering.
What were you
thoughts.
saying?
Thank you very much. Oh, there you go. And the final one is hyperactivity. So that's your fidgetiness. You're running around. You gotta move. You're always on the move. Let's say you're cleaning your house for a moment, then you stop that and you go make some breakfast. Then you stop that and you go do your hair. That's some of the hyperactivity elements of ADHD.
Sure.
Now, when you're a child, there's different elements. There's primarily inattentive, primarily hyperactive, or primarily impulsive hyperactive.
Okay, so there's different
different combinations.
Of,
exactly. And hyperactive
of the
impulsive.
symptoms. Yeah.
So there's different types. When you look into adulthood, typically that inattention. So let's say this is childhood and this is adulthood. I guess it's backwards on the camera, but the inattention will last your lifetime. That doesn't change in nearly all patients. The hyperactivity and impulsivity, you tend to decrease those, mostly because you're maturing as an adult and you realize that people hate it when they interrupt you. And there's a negative feedback.
We just get tired
mechanism.
as adults anyway.
Now, what's really important, though, and I bring this up a lot, when you look at females and little girls, people think of ADHD as that little boy's hyperactivity thing.
Right.
And it's true, it's there, but that affects people. People see the hyperactivity. Girls are mostly affected by the impulsivity and the inattention.
They have a little slightly different profile.
Different presentation,
right?
yeah. And it's so, I've sat in market research meetings with parents on the other side of the glass. And
watching their kids.
I've seen a whole group of adult marketers and doctors were crying because they talk about how impactful it is to their daughters, especially because they can't make friendships. And the females, they everyone likes to talk and likes to be heard, and if you keep interrupting people, and that's what females with the impulsivity and
so they get sidelined from friendships.
They have a major issue with that. So, and then when they get treated, it's like their life changes, and it impacts life. It's not just about academics. It's not just about I'm smarter or not. You're basically giving your brain the opportunity to do the excellence that it has built in.
Okay. I just want to finish the segment off just explaining what some of the shortcomings are of existing ADHD medications. We've talked a little bit about this, where it wears off too soon.
Yep.
Maybe you can highlight for us just the 3 or 4 kind of...
The number one issue, when you look at the 4 largest medications, so you got Concerta, Vyvanse, Adderall XR, and Vocalin XR. 4 great medications. They all are great drugs, and they did a really great thing in the late 90s and early 2000s. By the way, 2005, that was the last time we had an innovation in ADHD. Last time.
Yeah. Wow.
Until now. Those products are great. What they did is they solved the problem of taking that second dose. So where you had to go at lunchtime to get your second dose, they solved that problem. The problem is all 4 of those medications do not deliver medication after 4 hours.
And probably not in the right concentrations either, or the right amounts, because
right.
They're
also dosed,
huge
the
bolus
ratio
or spike.
The ratio of the way they've designed those medications is flawed.
Yeah.
So Vyvanse is a prodrug. It's just 1 dose.
Yeah.
And it's a prodrug that sort of bleeds out over a period of time. That's why it takes 2 hours clinically to reach its maximum effectiveness. Our product will be there in 15 to 30 minutes. You want the drug to work right away. You don't want to start your day off on the wrong foot. How often, if your day starts bad, how often does it get better?
Yeah. I think what you're saying is that instead of these kind of spikes like this, you're getting this more even curve.
More of a sustained release, which you don't want in ADHD.
And also, when you think
about
hypertension,
hypertension, you want that sustained release. This isn't hypertension. This is a neurodevelopmental disorder.
Yeah.
You need the brain receptors to reset. So you need to have a nice onset, slow down a little bit, then a sustained release, get you through the late morning, early afternoon, which is what we do.
Okay.
And then 7 hours later, that's where the crash and the rebound and the need for booster doses happen. We precisely timed it 7 hours later, just 20% of your overall dose, stop the rebound, stop the crash, avoid the booster dose, avoid any abuse and diversion like you were speaking about of those short-acting stimulants, because there is a street value for those. Our product will have no street value, and I'm glad. No street value, because the medication works your entire active day.
Yeah.
That's it.
Yeah.
No booster doses, no exciting, euphoria.
You just take it at 7 a.m. and you're set for the day.
Yep.
Yeah.
And you have a great side effect profile as well. Almost a 30% reduction in side effects versus the active comparator.
Yeah. Okay. Well, great. Yeah. Shane, thanks so much. And again, we had Dr. Shane Schaffer, the CEO of Cingulate, who is sharing with us some of the details of his CTX 1301 product and also the precision type timed release platform. For more information on the company, please see the company under ticker symbol CING.